Cancer treatments put patients at a higher risk of infections, but untreated cancer poses health risks of their own. As patients weigh the pros and cons of continuing treatment during the pandemic, cancer centers here in Texas are remaining open and taking extra precautions to put their minds at ease. Our Nicole Cross spoke to a cancer care provider to find out what's in place to protect their patients from COVID-19.
Patients with compromised immune systems, including cancer patients, face a dilemma during this coronavirus pandemic. On one hand, they could be hunkered down, protecting themselves because they're more susceptible to viruses like COVID-19. But on the other hand, it could be problematic if they discontinue their cancer treatment. So we've got cancer centers all across the Lone Star State who are remaining open. That includes Texas Oncology. And to share those details with us is Dr. Debra Patt. She is the Executive Vice President for Public Policy and Strategic Initiatives at Texas Oncology. Dr. Patt, I'm delighted to have you with me. Happy that your facility is remaining open, but want to hear more about the precautions that you all are taking amid this coronavirus pandemic.
Thanks, Nicole. So it's a really important topic because while most of us are trying to stay at home and socially distance, cancer patients really need to receive therapy even during this crisis, because the natural consequence of patients not receiving therapy for several months if they have cancer usually will lead to an adverse outcome. And so while there's variability between cancers, and those are important discussions between doctors and their patients, patients need cancer therapy. So by having a telemedicine platform, it allows us to keep potentially infectious patients out of the clinic. It allows us to continue to provide care for follow-up patients while reducing the volumes in our clinic. It allows us to see and evaluate new cancer patients that may be fearful to come into the clinic for evaluation.
You know, COVID-19 is not happening in a vacuum. Many of us were dealing with health concerns and other things prior to the surfacing of the coronavirus pandemic here in the United States. And I'm so happy that you are providing a resource to patients even amid the coronavirus pandemic. So thank you, Dr. Patt, for sharing those details with us. And thank you for being on the front lines and continuing to take care of our state.
It's our great pleasure. Thank you.